Look Outreach is underwritten by the generous support of Munter Enterprises. Family owned and operated since 1972, integrity is important, as our family name is on every project. Our word is our bond. Munter Enterprises. Just build it.
Welcome back, everyone. Well, I think it was probably around 10 years ago that the term urgent care started to become part of the dialogue when we talk about healthcare. And let's face it, over the years, it's just gotten healthcare on a national level. It's just gotten more and more complicated. Congress right now is debating all kinds of issues regarding care. Some people get left out, some people are included, and urgent care really fills in an interesting gap. But interestingly enough, there is a difference between urgent care and emergency care. And one of our partners, Hudson Headwaters, these two, this doctor and this physician assistant, head up the urgent care team at Hudson Headwaters. We invited them in to talk about this. This is Carrie Miron. Welcome, Carrie.
Thank you.
You are a physician assistant, but lead physician assistant in terms of urgent care at Hudson Headwaters.
Yep.
And this is Dr. James Hicks, who's the lead physician for urgent care. Welcome, both of you. Very nice to have you here.
Thank you.
It's, without a doubt, healthcare is front and center on the minds of everybody. They don't know what some of the details are in healthcare bills and whatever. But one thing comes down, the one thing that really just comes to my mind immediately is the fact that if you're sick, you need help. And if you need help, you have two choices, really. If it's an emergency, you either go to an emergency room or now it involves urgent care. I'll start with you, Jim. In terms of urgent care, how would you define that?
Well, there is actually a definition for urgent care, which is the provision of health care for non-life-threatening, non-limb-threatening illnesses and injuries, usually acute. Mm-hmm. It needs to be a center with expanded hours, with expanded services, including X-ray and lab. And it needs to be a freestanding facility from a hospital. Mm-hmm. You can't have it attached to your emergency room.
Right, got it. Carrie, there's something that differentiates Hudson Headwaters. It has to do with the word team, mm-hmm. right? Mm-hmm. That the two of you are the principal drivers for urgent care, but there's primary care. There are other aspects of healthcare and well-being that Hudson Headwaters has been particularly effective and successful at combining. Mm-hmm. How does that work? Say someone comes into urgent care.
Sure. We have the ability in urgent care to see the charts of our urgent care or our Hudson Headwaters patients. So we have our primary care providers who see Hudson Headwaters patients. Every record of that patient is in our computer system that we have access to here in urgent care, and that includes medication lists, problem lists, wow. specialists lists. If you're seeing specialists in Hudson Headwaters, we can see their notes. Mm-hmm. It's just an all-inclusive medical record, and we have access to that information as well.
Access, of course, is key there, right? Mm-hmm. So whether it's nursing home, hospital care, specialty, primary care, urgent care, that team is interconnected with all of the information regarding that patient, mm-hmm. and you never know what you're going to need, right? Mm-hmm. Isn't that true? You said something interesting when we were talking before we came on air, that the whole idea of healthcare is really to provide a safety net. Mm-hmm. And I can tell from talking to both of you, I mean, you've been involved for 10 years with Hudson Headwaters, mm-hmm. you've been involved for 13 years with Hudson Headwaters. You really do, you're driven by that philosophy, aren't you?
Oh yeah, it's the reason we work for Hudson Headwaters, and we've worked for them for this long. It's part of the whole guiding principle of Hudson Headwaters is mm-hmm. providing care and providing access. Mm-hmm. And urgent care is a big part of that.
Yeah, it sure is. Now, some of you are probably saying to yourself, well, I think I understand the difference between urgent care and emergency care. But I can simplify it, or at least dumb it down for myself. This would be important here. That if it's a stroke, if it's related to a heart attack, if it's poisoning, if it might be convulsions, or it might be related to a pregnancy, you head to the emergency room, right? That they can be better equipped on a short notice to be able to deal with some of those things. Is that correct?
Absolutely.
Okay, so then try to give me some sense of what someone would go to urgent care for.
Minor cuts and injuries, illnesses that have been going on for a little while that you feel have maybe been going on too long, or you feel more ill that you want to have attention to.
So if you're getting fevers, you might feel that you've got a flu, you might have a serious headache, you know, those kinds of things, right?
Right. Again, minor illnesses, again, but the problem is one size doesn't fit all. A fever in a baby who's less than a month old is a different animal than it is in myself. So it's hard to know sometimes. It is a little bit confusing, but generally speaking, bumps, bruises, coughs, colds, sniffles, sore throats.
Which tend not to happen 9 to 5 during the week, by the way, that you're going to wake up on a Saturday morning or a Sunday morning and guess what, and that's really the time to do it. But I think the point that we should make here is that you know when it is a stroke, if you're going numb, if there's something seriously wrong, head to the emergency room, but everything kind of in between there, where you know that you need some care, you're looking for a bit of a safety net, well then you head to Hudson Headwaters in Glens Falls, Broad Street, and then of course your main facility in Warrensburg, correct?
Correct.
There's a website also, and I found this kind of interesting because this is 2017, so if you can go to hhn.org and you can get a sense of what the waiting times are at urgent care, and you can make an appointment.
A call ahead, essentially.
Yeah, careful with that one.
Okay.
Some people have experience with this at restaurants. It's you're getting in line, but you can see how long your wait is at each health center. You can put yourself in at a time that we will place you in line, and it'll allow you some flexibility with how you want to manage your day, give you a text alert.
Well, sure, the key there, of course, is you don't know really the severity of something until someone is there, and there should be a priority for someone who needs more urgent care than someone else, right?
Excellent.
Of course.
Yes.
But the thought is that it's there, and I think that especially in this day and age, really bodes well, both of you. Really, your dedication is really apparent, both of you, spend all that time helping people. It's wonderful. The safety net.
It's fun.
Carrie, very nice to meet you.
Thank you.
Jim, very nice to meet you. Thank you for coming in.
Thank you.
To see this interview again, you can head to our website, looktvonline.com.